I call on Government Orders of the Day numbers 4 to 11.
Accident Compensation Amendment Bill number 2, third reading. Burial and Cremation Amendment Bill, third reading. Children, Young Persons and Their Families Amendment Bill number 2, third reading. Holidays Amendment Bill number 2, third reading. Land Transport Amendment Bill number 3, third reading. Medicines Amendment Bill, third reading. Mental Health Compulsory Assessment and Treatment Amendment Bill, third reading. Misuse of Drugs Amendment Bill number 2, third reading.
Mr Speaker.
The Honourable Dr Jonathan Coleman.
Mr Speaker, I move that the bills divided from the Health Practitioners' Replacement of Statutory References to Medical Practitioners Bill be now read a third time. This bill will amend 8 acts to remove references to medical practitioner and replace them with the words health practitioner. That's going to enable a wider range of suitable health practitioners to undertake certain functions that are currently restricted only to medical practitioners. Mr Speaker, New Zealand's health workforce is evolving, and many health professional groups are now capable of performing the tasks that were previously the sole domain of medical practitioners. The purpose of this bill is to improve access to services for New Zealanders, and this government wants to ensure that people receive timely care from the most appropriate health practitioner close to home. And that's going to be a very necessary approach if we are going to have a sustainable health system that can provide the services that everyone across the country needs in the long term. And this bill, Mr Speaker, or these 8 bills divided from the original bill, align very closely to the New Zealand Health Strategy, which is all about moving care from secondary care out into the community, taking a preventative and early intervention approach, and very importantly, using all the skills that we have right across the healthcare workforce and deploying them in the most effective manner. So, Mr Speaker, I'd like to thank members from across the House for the support that they've given to this omnibus bill in its earlier readings, and I'd also like to thank the Health Committee and those who took the time to make submissions on the bill. The bill has had a long passage to this stage of the parliamentary process. This has ensured that we now have a fit-for-purpose bill which will make real changes to how people can access services from health practitioners. Not only have we enabled suitably qualified health practitioners to undertake statutory duties, but we've also used the opportunity to make statutory terms and descriptions much more consistent right across legislation. I know that a number of members focused on the meaning of amendments for the work of nurses and nurse practitioners in their speeches earlier in the debate. The amendments in this bill are designed to ensure that all suitably qualified health practitioners are able to undertake certain statutory activities if they have the required training, knowledge and skills. In some cases, nurse practitioners will be the only suitably qualified group. In other cases, nurse practitioners, registered nurses or pharmacist prescribers may all be suitably qualified. For other statutory activities, a range of health practitioners may be suitably qualified and the most appropriate and available people to undertake the task in hand. The safety of the public remains secure as the regulatory framework governing health practitioners continues to be managed through the Health Practitioners Competence Assurance Act 2003. So I'll briefly sum up the amendments in each part of the bill. In Part 1, we're dealing with amendments to the Accident Compensation Act. The bill amends Schedule 1 of the Act so that any health practitioners providing treatment to the claimant are given the opportunity to participate in the preparation and costing of an individual rehabilitation plan for the claimant to the extent that they are willing and able to do so. Examples include physiotherapists or occupational therapists. In Part 2, we've got amendments to the Burial and Cremation Act. This bill amends the term doctor's certificates to certificate of the cause of death. References to medical practitioner are amended to allow nurse practitioners to also issue certificates of cause of death, and that is quite a major change. Nurse practitioners are qualified in a similar way to medical practitioners to issue these certificates through their training in diagnosis and their position as lead healthcare providers. And I can tell you, certifying death is not as simple as it may sound, Mr. Speaker. Part 3, amendments to the Children, Young Persons and Their Families Act 1989. The bill amends references to medical practitioner to enable a social worker to request suitably qualified health practitioners to examine a child. The bill also replaces references to psychiatric hospital to hospital to give it the same meaning as in the Mental Health Compulsory Assessment and Treatment Act 1992. In Part 4, we've got amendments to the Holidays Act 2003, and those amendments mean that proof of injury or sickness under the Act may include a certificate issued by a health practitioner rather than just by a medical practitioner, i.e. a doctor. A suitably qualified practice nurse could provide a certificate of proof of illness or injury which would save the sick person both time and money and make the best use at the same time of the health practitioner's precious time. In Part 5, we've got amendments to the Land Transport Act 1998. The bill now amends references to medical practitioner to allow health practitioners to undertake duties relating to taking blood specimens and assessing the fitness of people to drive. The bill is also an opportunity to update the terminology so that references to doctor's surgery and surgery are now replaced with the much more common term medical centre. In Part 5A, we've got amendments to the Medicines Act 1981, specifically an amendment to Section 105BD of the Act, meaning that nurse practitioners will be able to supervise designated prescribers. Nurse practitioners, like medical practitioners, are authorised prescribers. As new prescriber groups are established under the medicines regulations, it's important that we have sufficient authorised prescribers to provide the support and mentorship that's going to be needed in order to deliver safe practice. In Part 6, we've got amendments to the Mental Health Compulsory Assessment and Treatment Act 1992. And this amendment is going to provide the opportunity to insert a new definition of nurse practitioner so that the legislation aligns with other legislation. Section 8B is amended to allow a health practitioner who's either a medical practitioner, nurse practitioner or registered nurse practising in mental health to issue a certificate to accompany an application for assessment. And of course, currently only a doctor can issue such a certificate. Section 9 of the Act is also amended so that an assessment examination may be undertaken by a medical practitioner or a nurse practitioner who is approved by the Director of Mental Health. Currently, only medical practitioners can undertake that important and very sensitive assessment. So that amendment is a very good example of enabling a suitably qualified person to undertake an assessment examination. Often the nurse practitioners practising in mental health are not only the people who are most available, but also they may be the people who have the most knowledge of the history and the current situation of the patient before them. In Part 7, we've got amendments to the Misuse of Drugs Act 1975, and that allows specified nurse practitioners, registered nurse designated prescribers, and pharmacist designated prescribers to prescribe controlled drugs for the treatment of addictions. The parameters for the new groups to prescribe under this Act are the same as those for medical practitioners, including the need of health practitioners to be compliant with applicable guidelines issued by the Director-General of Health for the treatment of addictions. So, Mr Speaker, the purpose of this omnibus bill is to reduce legislative barriers so that competent health practitioners can perform a number of statutory functions that were previously limited to doctors only. Changes to the statutory provisions in the bill will allow competent health practitioners to use their qualifications, knowledge and skills to the full scope of their practice and ultimately help us deliver better health outcomes for a greater number of New Zealanders. This bill is also going to help us run the health system in a much more efficient manner and improve health practitioner accountability by making practice much more transparent. The government intends to review unnecessary restrictions for statutory functions for health practitioners in other acts as they are revised. Mr Speaker, this is an excellent bill. I thank everyone who's been involved with it, and I commend these bills to the House.